Good afternoon. Today we're here with Sean Flood, and Sean works for Alpha-Medicor Health Group. And today let's meet one of the therapists that works at Alpha-Medicor. Sean, thank you for today, and want to get a little information about you. Patient's looking at you right now, and probably is asking some questions in his or her own mind. But let's start off first by the degrees that you have, because I know you got a couple of them, and more importantly, what made you, what do you do at Alpha-Medicor? How do you help the patients? So,
I'm a clinical therapist here at Alpha-Medicor. I have my BSW from Misericordia and my master's from Temple University. What I do here at Alpha-Medicor, basically meet the patients where they're at. When they come in here, we help treat their addiction, but there's many other issues that may be affecting them, maybe keeping them from sobriety. We try to help with the multiple problems they may be encountering. There's various issues that we may have to tackle, and we just try to help people get their life back on track. It's not just focused primarily just on recovery, it's everything.
okay, so life skills, and not just focusing on the recovery or the addiction, but how's life going, right? And kind of the fundamentals surrounding that.
Absolutely.
What made you get involved in addiction medicine? Why do you want to treat somebody strung out on heroin or opioid or Oxycontin? We throw out this word opioid dependence, but let's break it down. Oxycontin, fentanyl, perks, heroin, why do you want to treat that patient?
I think this population is often not treated with the respect and dignity they deserve. We have a terrible problem in this area, which is well documented in the papers and the news almost on a daily basis. I feel there's not enough treatment out there, not enough people that care, not enough people that are giving these people their all and fighting for them. And I think they deserve a voice.
Fantastic. So you enjoy what you do because you're serving kind of the people that people don't want to serve. Is that fair enough? Fair statement?
Absolutely.
Okay. So a new patient, they want to come in for services, they're scared. What do you say to that patient that's really scared to come in and seek treatment at all?
I think it's terrifying when you have to go to a new place and open up to somebody and explain to them I have an addiction or I have a problem. We understand. We try to be as compassionate and caring as possible and make you feel as comfortable as we can when you come in the doors. That's our goal for every new client, I think. And it's our goal to make them feel that way.
Okay. What's some of the toughest stuff that you see out there with a patient coming in for the first time? What do you just share a story if you have a story that a patient can relate to that is tough for them to work at or to take care of?
I think we have a lot of people that come in here and it's almost like their little secret. Their family doesn't know, their loved ones don't know. They feel ashamed, embarrassed, but they know they need help. And it makes it difficult for them to seek help because they've had it hidden for so long. And I think that's the benefit too, because finally they can come and they can have someone that they can talk to, someone they can reach out to, someone that can help them. And they don't necessarily have to expose what's going on to the whole world.
What suggestions can you give a patient that's looking for a Suboxone doctor, and maybe why, if they're in our area, why pick Alpha-Medicor? Why come see Sean?
Well, we care. We're gonna help you in any way we can. We're gonna treat you with compassion. And this medicine, along with the therapy, it works. We have seen hundreds of lives changed. We have numerous success stories. I have personally, in the last 2 or 3 years I've worked here, seen so many transformations, and it's really encouraging. I wouldn't still be here if I didn't believe in this program and the work we do here. I've personally seen so many lives change that I know that this is effective.
Okay. So for a patient that can't get to an Alpha-Medicor program, what should they be looking for in, say, a doctor or a therapist to provide them specifically for, they want Suboxone. what should they be looking at if they're serious about recovery? What are the telltale signs? What would you tell a friend that needs help?
Look for someone who cares. Not a doctor that's just gonna write a prescription and have you out the door in 5 minutes. Someone that's gonna take the time to get to know you, get to know the issues, the circumstances surrounding your addiction in your life, the barriers that you may be encountering to sobriety. This medicine is a great help, but in and of itself, it'll be ineffective if you don't address the other issues in your life. And I think that's very important. If a provider isn't providing those services for you, I think he's doing you a disservice.
Fantastic. Sean, thank you for the mini discussion today. We'll look for more comments and even questions for Sean Flood, and give him a call and he'll answer some questions and take care of you like we all do here at Alpha-Medicor. Thanks so much.
Thank you.